Judith, and today I am going to speak about coping methods for autism and attention deficit disorders. So, according to one dictionary, coping is to face and deal with responsibilities, problems, or difficulties in a successful manner, in a calm and adequate manner. So handling situations in that way. And there's also emotional coping, which it will include that we use information, knowledge, experience instead of becoming compulsive using our physical body in order to resolve our problems. And also using our emotional intelligence. So to begin, or in order for us to cope, we will have to understand self. And that will include understanding self, including our diagnosis of autism or attention deficit disorders, if we have been diagnosed with such conditions. So understanding of self, how do I handle matters, how do I approach others, other humans. Understanding self means that I will also understand how the condition of autism or attention deficit disorder is affecting me and how I'm being affected by it also in comparison with others. What are the similarities? And what are other humans saying about me also? We should take that into consideration because we may have a view of self, of how we view ourselves, what we think of ourselves, having our own personal opinion about self. But other humans can also have their own opinion about ourselves, and it could be things that we are not paying attention to or giving the proper care to. So is it true? Is it true what others are saying about me in regards to how I comport myself, my personality, my character? Is it true? And then if it is true, then how to cope? Because we want to have good relationships with others. And that is why this matters, because we want to have good relationships with others. We want to be friendly, be happy, enjoying lives with others, our life, right, with other humans. And so we want to be able to do this in a way that everyone can have a good time. And so we want to know what the condition is that we have. If it's attention deficit disorder, what it is, what are the symptoms, do I have them? And if it's autism spectrum disorder, the same thing. What are the symptoms? Do I have it? What do I know about autism? So in regards to attention deficit disorder, according to the American Psychiatric Association, it says that attention deficit hyperactivity disorder, or ADHD, is one of the most common mental disorders affecting children, but also affecting adults. So those children who are affected with ADHD are going to grow up to become adults affected by ADHD. So the symptoms, the main symptoms that are known that come with attention deficit disorders are inattention, hyperactivity, and impulsivity. So it is behavioral, it is cognitive, and It has to do with our moods or how we're feeling, our emotions. And also common in these are depression or learning disabilities. And this is due to, of course, the inattention when it comes to learning, retaining information. If you cannot focus and concentrate on what is being said, then you will have difficulty in remembering, difficulty in then learning, discerning, understanding, applying or using what you're learning or the information that it's being given to you. So when it comes to inattention, you may have difficulty not or you're not keeping focus. You're not focusing on what is being said. You want to do something else in the middle of whatever is going on. It could be a meeting, it could be at school, and it could be that your boss is giving you instructions on how to do a task, and you can keep up with listening to the person. And when it comes to hyperactivity, it could be excess movement that is not fitting to the setting. For example, standing up when you're supposed to be sitting down for some time, and being able to listen and pay attention. So that could be also fidgeting, right? It could be also lack of restraint. You want to maybe say something before the person ends speaking. And then it could be impulsibility, hasty acts that occur in the moment without thought. Okay, so you're not really thinking of what your physical action is going to cause. You just do it. So that's being impulsive. And when it comes to actions, for example, behavioral actions, becoming aggressive maybe, right? And having lack of restraint. And so the person who becomes irritable real quick, get angry real quick, may hit someone before thinking about it, or before saying I'm gonna hit you, and they're hitting someone already. So that will be being impulsive. And so of course these things lead to having relationships with others that become difficult, strained, conflicted, problematic. Because if we are in a constant fight, arguing, proving your point, then of course you're going to have relationships that are strained and difficult, and all of that brings more stress to deal with. So learning what attention deficit disorder is and how it's affecting me, how it's affecting you, then matters, as you must keep in mind that first get treated, right? Seeking help for it. And we know that when it comes to the attention deficit disorders, it is related to your thyroid, dysfunction in the thyroid. So also in your endocrine system. So that's out of balance, then your body's out of balance, and you get attention deficit disorders. Treating your thyroid, making sure that you have enough of the hormones that it needs, and also having vitamins, for example, vitamin D3, vitamin magnesium along with the D3 because it activates the vitamin D3, which is a hormone inside the body that is required by every cell in the body. And then also magnesium activates the vitamin D3, and then vitamin E. Vitamin E must be intake with vitamin C, and then also omega-3. So those are very important when it comes to our health. But for those with the attention deficit disorders, and also others who go through hormonal changes or hormonal imbalances, for example, those for women, for us women who go through the cycles of menstruation every month. Every month we go through a hormonal imbalance. So making sure that our thyroid is not deficient from the T4 or T3 hormones that are necessary, or from not being deficient also from the vitamin D3, the magnesium, vitamin E, vitamin C, and the omega-3. And also zinc. Zinc helps, but you only need a little piece, like 5 milligrams of zinc in your body every day. Zinc helps with our cells also. And of course, those are the main vitamins. So if you take multivitamins that have these vitamins that I have mentioned, then it's even better, because we need all the vitamins in order for our body to function the way it should function. You're not curing anything by intaking vitamins. You're putting in your body what your body requires and needs. So coping will include that you take care of your health in that way. Also exercising, making sure that you get enough sleep, hydrating, all of it helps. And making sure that you don't have other underlying conditions. For example, taking care that you're not diabetic, taking care that you are not hypertensive, and if so, taking care of these things. So that is for those with the attention deficits with hyperactivity disorders. Now, when it comes to those in the autism spectrum disorder, right, which is a different condition affecting the brain, and again, these are physical effects that we have in our body, but that ultimately will affect the way our brain functions. Right? So it's a physical thing. For example, those with the attention deficit disorders, they may have dysfunction or malfunction with their thyroid, but the effect is a mental health, being unstable mentally, right? So it becomes a mental health matter. For those in the autism spectrum disorder, it is the same thing. The brain, but in that situation, the brain is affected because of the developmental or the growth of the brain. Those in the attention deficit disorder with hyperactivity have a developed brain, but thyroid malfunction or dysfunction. Those in the autism spectrum disorder have a brain that did not develop completely, and so it did not make the connections necessary that it needed to make in order for it to function appropriately. And then there's also malfunction then because it did not develop properly, or the growth is not fully developed, And this is from conception, right? So those with the autism spectrum disorder are affected since conception, because it has to do with the nutrition of the mother, which is mostly responsible for the formation of the child. Remember, we are made out of cells that are made out of proteins, out of fatty acids, out of amino acids, minerals. All of these things are found in our body. If we're lacking these, then when it comes to a woman who is pregnant, lacking these nutritional values in her body, then whatever the baby is pulling in order to form, right, the embryo, whatever is pulling and it's not there because the mother is deficient in vitamin D3, the mother is deficient in amino acids, the mother is deficient in fatty acids, then that baby's brain development is not going to be completed as in the situation with those mothers who have a better nutrition. And so when the baby comes out, when the baby is born, right, then you notice this as autism, or what we know as autism. Having the baby having problems, then making connection with the eyes, not focusing, having all sorts of problems. And then also we see it more as a communication problem or difficulty that the child will have. And it is that way. Now, the way that those who are in the autism spectrum disorder, they process the information in a literal way, which is something that doesn't happen with those with the ADHD. They can process information in a figurative way. They don't have problems understanding the emotions of others that they are from their face. But those in the autism spectrum disorder cannot, their optic system that's supposed to be attached to the brain, receiving the information and bringing it to the brain so that we can process it, the autistic individual is not able to do that. So then there is there is something that's not connecting with the optical system with the brain. But that doesn't happen with those in the attention deficit disorder. So there's a difference there. And then the learning also, they both seem to have learning inabilities, but for different reasons. The one with attention deficit disorder cannot focus, even though that if he could focus, he could understand everything and discern things, even emotions, and understand figurative language. But for the one who is autistic, it doesn't happen that way. And that is because of how the brain formed. So the person who is autistic can understand the information, but in a literal way, never in a figurative way. Then of course making communication difficult, because if I am speaking in a figurative way and you cannot understand it, then it's going to cause a communication difficulty and therefore relationship difficulties. And so there are comorbidities in those with the ASD or autism spectrum disorder. And everything has to do with our nutrition. So a person who is autistic can have other conditions such as diabetes or being hypertensive, just as how it can happen with anyone else. So for those who are autistic, also having their thyroid check, making sure that the body is processing the hormonal process in the way that it should happen, it is important that we check all our body parts, including our thyroid and including deficiencies that we have in our bodies. And just the same, intake of multivitamins that include zinc, that include vitamin C, vitamin D3, vitamin E, and omega-3. Omega-3 must be intaken separately. So having these will be able, having our nutrition taken care of is a way to cope. Is one of the most important ways to cope, because if we feel good, if we feel fine, if we don't feel anxious. And then also, I forgot to say and to remind again that vitamin D3 have to be taken with magnesium, which is at night, and even melatonin if you have difficulty sleeping. And of course, just as for those with the attention deficit disorder, sleeping, exercising, eating well, hydrating is all important. And we're doing this because our body needs it. Both groups, those with attention deficit disorders and those with autism, should take care of their thyroid, should take care to fulfill their deficiencies in their bodies, especially of vitamin D3, magnesium, vitamin E, vitamin C, and omega-3, which could be taken every day. And zinc, having just a little piece of zinc every day, very small piece, maybe 5 milligrams every day. That should help. So knowing the effects of these conditions is the first thing in coping with our emotions, our feelings, the way that we're learning, right? And taking into consideration also, if you're autistic, that if you understand language in a literal way only, then there is an extra effort that you will have to put forth in order for you to make use of language properly. Not scripting and not identifying as someone else, as some have the custom, because that will only bring more problems and conflicts in communication. And then I have mentioned that, of course, to cope, we need to be calm and also to do so in an adequate manner in order to be successful in our communication, in our relationships with others. So coping means that. But then there's also the emotional coping that I mentioned, and that is being conscious, right? So you're conscious, you're knowingly of your emotions as we use our physical body. So we keep a restraint as we approach a matter or situation. So it will involve our psychological composition, and that involves how we use our information that we have in our brain, how we use our experience, whatever we have learned, how to put it to use, and how we express our emotions, and that is especially under stressful circumstances. So remaining calm and using instead our emotional intelligence, right? Keeping strength, keeping control of self instead of giving to physical actions is best in order, or it is what is known as emotional coping. So coping with our emotions instead of also avoiding people. Sometimes we get into arguments and we don't know how to make up with the person, how to say I'm sorry, and sometimes that is the only thing that we can do. If you do not say, I apologize, and then try to make the situation better and not do whatever caused the problem again, trying not to do it again, that is what will fix that situation. Avoiding it is going to make it worse. Or sometimes we want to speak right away, try to fix it right away. But the other person is not ready for me to speak to him or to her. So I need to respect the person and allow the person to cool off, to think about what went on, and then maybe address the situation at another time. So this is all done while being and remaining conscious of our actions, right? Taking in responsibility of our feelings and thoughts, while looking also for solutions. So we should identify what is the stressor or who is the stressor, right? Handling the matter accordingly. So what else? Is it something that you can control? There are things that we can control, but there are things that we cannot control for whatever reason. We cannot control it. Definitely we cannot control other humans. Other humans have the same as I have, free will. So I can come to compromises, we can talk about matters, and we can compromise, we can come to agreements, but I cannot make someone do whatever I want because I want it and that's it, and he or she must do it. No, because that is, I wouldn't like that, right? So we have to think about in terms of if that was done to me, would I like that? And we cannot control other humans. There are situations that we can control, and there are situations that we cannot control, that we shouldn't control, or that we are prohibited from controlling too. So should anyone else intervene in the situation? Family members, friends, a therapist, a specialist, authorities? We can take that into consideration. Also, have you taken into consideration all factors and being balanced, being just, not over exaggerating matters? Sometimes we tend to do that to justify self, right? So we tend to make the situation bigger than what it is, or say it in a way that maybe is not what really happened. But in reality, we're not being just. So if we're not saying that the way that it really happened, then we're not being just. And then find support in others, right? Family members, friends, psychologist, psychiatrist, getting therapy, getting a support group. All these things can help us cope with our situations. But the first and most important thing that we can do in order to cope is that we take care of our nutrition, our deficiencies, making sure that we check also our thyroid levels, our vitamin D3 levels, vitamin B12, I forgot to mention, vitamin or B complex, magnesium, vitamin E, zinc, vitamin C, right? So doing all these things. And also if we can, for some, they can have the vegetables and the fruits and then get their vitamins from there, their minerals. And we need fatty acids, we need all these things, right? So some people can get it from the food, but it can be very expensive. So if it is too expensive, then you can get the vitamins as a supplement, and then also get your thyroid checked. So this was coping methods for autism and attention deficit disorders. And my name is Judith Mendoza. Thank you for watching my videos, and until next time.